I'm Jessica Lombard, Associate Superintendent.
And I'm Superintendent John Berkey, and this is Huntley 158 Today. As you probably know, from just what's been in the national media, the opiate crisis is getting worse and worse in many communities around the United States.
Well, Dr. Berkey, we've been very lucky in Huntley that we have not experienced some of the issues that others in our county and across the state and the United States have. Today we have Laura Crain, Drug-Free Program Coordinator, with us. Laura, tell us a little bit about your background and what does this organization do?
Sure. So I've been doing prevention myself for about 10 years. I started with District 200 in Woodstock and had a grant there called the Drug-Free Community Grant. The county then wrote for the same grant, and I transitioned into the county position to do prevention on a bigger scale. The Substance Abuse Coalition for McHenry County has about 185 members right now, most of them at a high active level, really participating. It represents about 60 organizations, schools, law enforcement, treatment providers, medical, parents, students. So a very good variety of the community. So we look at issues that are in front of the county in different views, so that we can really look at the problem not just from a law enforcement aspect, which is usually, how do you arrest someone or how do you improve those situations, versus treatment, who wants to focus on the individual. So kind of looking at the problem overall.
So we mentioned earlier how the opiate problem, is worse kind of nationwide. Mm-hmm. What is the situation in McHenry County?
So in McHenry County, unfortunately, we are seeing some of the same thing the nation is. Last year, we had 56 overdose deaths in McHenry County. Of those, 42 of them were related to an opioid. This year, unfortunately, we are already at 60 deaths from overdose, and again, the majority of those from opioids. And so when we talk opioids, we're talking about heroin, we're talking about prescription medications and illegal use of those types of opioid medications that are sold on the street.
So why is it getting worse? I mean, what's happening to cause this?
So there's two or three things that kind of came together, and one of them was that for a long time the medical community was looking for a zero pain tolerance. So when you were treated for something, you had the little happy faces at the end. Right. And so we started to transition to a thought that you have to have no pain. And opioids, unfortunately, in some ways, allow you to have no pain. And so they were prescribed a little bit more than they maybe should have. But this isn't a medical problem. I don't want to put that blame on doctors at all. It's also, we as a community then accepted zero pain, and so we look for zero pain. Opioids are highly addictive, more so than any other drug we've encountered. So it changes your function in your brain, actually sets you up in a situation where you start to decrease your ability to create endorphins. So that natural ability to create satisfaction and happiness goes away, and it's biologically blocked, and so then you need that.
So highly addictive.
Mm-hmm. Highly addictive, that's one of the pieces. It's also a very short-term type of situation. Prescriptions between 5 and 15 days can already lead you into an addictive path, which isn't the same usually as alcohol or other drugs that we encounter. And so I think that's part of it. The other thing is that we live in the heroin triangle. And so what that is heroin is sold primarily in Milwaukee, Chicago, Waukegan area, and then Rockford. So if you think about our major highway systems, we're right in the heart of it, so we have very easy access. And as opioid prescriptions, when you can't get them from your doctor, now all of a sudden you switch to the heroin, and heroin is about $10 a bag. So as a starting individual, that could be a day's worth of being high versus buying those prescription pills on the street. Could be about $160 for the same comparison.
Education is extremely important with this topic, with our younger students as well. What other things do you do in the schools to support that education?
So we do a lot of presentations trying to just educate people on what's real, not just about opioids, but all the drugs, because unfortunately if you've started with other drugs, you're more likely to have this addiction. And so we start to educate more about what's real, what's going on in your body, and having kids and parents start to understand that is critical. Mm-hmm. And then bringing in people who can tell their story so people can really hear, what this has done to them. And, unfortunately, opioids is different in a lot of ways, and that is everybody in the community is facing this. There is no real box that people are fitting in that we used to see.
What advice do you have for parents out there as they're talking to their students or looking for resources?
So looking for resources, the Substance Abuse Coalition is always available. I highly recommend the Mental Health Board as a resource in McHenry County. The crisis line, kind of a misnomer, because you can call them as well and just say, I have an issue and can you help me refer? 211, another great resource to just start connecting in the community. But advice to parents, talk to your kids. Really know what they're saying and doing when it comes to all drugs. Opioid specific, if you are an athlete especially who gets injured, opioids are prescribed a lot for that. Ask questions of your doctor. How would I know when my child might be in trouble with this versus just taking it to relieve the pain?
So what if a parent feels like their child may already be having a problem? Where do they go to get immediate help? What's the best place?
The best place is really to call the 211 or crisis line and ask for a referral to an assessment. We do have the A Way Out program, which you can go to the local police departments and ask for assistance as well. And that is an amnesty program where if you have any drugs or paraphernalia, you turn it in and there's no consequences for that. And then they actually help you walk through the program as well. If the student's under 18, they do need a parent to be with them for that, but over 18, they do not.
Laura, I really want to thank you for coming to talk to us today about this very important topic. Thank you for watching Huntley 158 Today from the Destination School District,
Where it's all students always.